Good morning, everybody. I am Jody Hanson. I am the Director of Public Affairs and Communication for Johnson County. Thanks for joining us this morning. We have several guests with us today. Dr. Sami Ariola is here. He's our Director of Johnson County Department of Health and Environment. Elizabeth Holshoe is our Director of Epidemiology. And we have a special guest with us today, Dr. Diane Peterson, who is our Chief Medical Examiner. So I think it would be great to get started with just an explanation, Dr. Peterson, of your role with the county and what you do for us.
Thank you. As you said, I am the Chief Medical Examiner Coroner for Johnson County. It is my responsibility to sign death certificates of and investigate deaths of individuals who die in our jurisdiction, and especially those who die due to non-natural means, but also by state statute, it is my responsibility to review deaths of individuals who die from a disease that's a threat to public health, which includes COVID.
Okay, thank you so much. And Dr. Ariola, I thought maybe you could explain why we've asked Dr. Peterson to join us today and what we'd like her to educate our public about.
Yeah, thank you, Jody. Good morning, everyone. And thank you, Dr. Peterson, for joining us on Facebook Live. To be clear, in addition to what she described, like we say all the time, this has been a teamwork. Dr. Peterson has been part of our conversations, part of our discussions throughout the process. So she really brings more, she adds more to this response than what she described. So she's been part of our response behind the scenes, most of the time with that tremendous knowledge, tremendous opportunity. But here's the deal. Quite often Dr. Peterson, we get these questions around the number of deaths. I think I've had the difference between dying from and dying with. And I know that you have worked very closely with Elizabeth and our EP team in ensuring that our death data are as accurate as they can. And I know that you have been very diligent. You have been conducting tests yourself when doing autopsies and those details. So if we just take us through this past 1 year, how that works, and just educate us, that would be very helpful to our listeners. Yeah.
Sure. So if anybody passes away in Johnson County and the hospital, the hospice agency suspects that COVID may have played a role or not, they will let us know when they report the deaths. So there are certain deaths that are required to be reported to my office. All deaths at home are required if they're unattended, and all deaths that are due to non-natural means. So in the beginning, we did notify the hospitals that COVID is a reportable disease and that deaths due to COVID were required to be reported to our office. We also notified nursing homes and hospice agencies. And so anytime any of these individuals pass and COVID is suspected, either by their symptoms or they've had a positive test, then the case gets called into us, and we take the history, we take the information, and most of the time they're natural deaths, so the private physician can sign the death certificate. There have been some that, as you've said, we've had to either test ourselves, my investigators who go out on scene, if while they're out on scene, the death scene, they get information that this person has had a fever, difficulty breathing, some of these symptoms of COVID, but maybe haven't been tested for COVID, then we are testing out on scene for COVID. If they have extensive medical history, then we will pass the results of that test on to the physician before they sign the death certificate. But some of them are unexpected deaths. Some of them have been young individuals. And so we've had to bring them in and we've had to do an autopsy in addition to that COVID test to see exactly why they died. So yes, we've been doing autopsies on COVID individuals. We've been testing COVID individuals. Every single COVID death has been required to be reported to our office. And if it's not reported, we still see it in death certificate data. And anytime we see it on a death certificate, we relay it to the epi team. So back to this question of dying with or of. I think it's important to understand the death certificate first. The death certificate has two parts, part one, part two. Part one is a cause of death statement. It's that disease or condition that immediately leads to the death. And it's basically 4 lines, the immediate cause of death, and then it's a due to statement. So everything underneath of it is due to. So this, the immediate cause is due to something, which might be due to another thing. And all of those things get listed if it's a due to statement. Part two are the contributing factors. These are diseases or conditions which contributed significantly to the death, but did not immediately lead to the death. So let's think of a non-COVID example. Part one might be a heart attack, which is a myocardial infarction due to coronary artery disease. So the immediate cause of death was that heart attack. The reason that heart attack happened was the coronary artery disease. In that contributing factors, we might have diabetes, because diabetes increases the rate at which you develop the coronary artery disease, but it didn't cause the heart attack, but it played a significant role. So when the CDC reports all of these things listed on the death certificate, they are listing everything in part one and part two that's been listed on the death certificate. Because after I fill out a death certificate or any other physician, it goes to the state and the state assigns a code to each line. And the CDC reports out those codes that correspond to all of those lines. And so anytime you see CDC data, it's lost that context. It's lost that due to statement. It's no longer in the proper order. You don't know where on the death certificate it was. Was it part one, part two? You just know that it was on the death certificate. So it kind of loses a little bit of that context when you look at the lists of reasons that people with COVID have had listed on their death certificates. So I'll give you an example of some COVID cases that we've had where COVID might be in the cause of death statement, or it might be in the contributing factor. Either way, it's important to be included on the death certificate. Anything that plays a role in the death that you can say, but for this condition, this death would not have happened at this time. So if you cannot say, but for COVID, they would not have died, you need to put COVID on the death certificate. So within the cause of death statement, things like pneumonia, COVID causes a very unique pneumonia. Under the microscope, the cellular changes that COVID causes, I've never seen in any other virus before. It's very unique changes. The cause of death statement for that might be COVID-19 pneumonia is what some people call it. It might be the specific changes that I'm seeing due to COVID-19 infection. And that would be in the cause of death statement. A scenario where COVID might be a contributing factor is we had a case of a person who had a blood clot to the lungs. She had had COVID for about a week or so. During that week, wasn't moving very much. And then developed a blood clot that went to the lungs and killed her. The cause of death is that blood clot to the lungs. That's in the cause of death statement. But for the COVID, she would not have developed that blood clot. So COVID is a contributing factor. It did not immediately cause the death. The blood clot immediately caused the death, but it played a significant role in the death. So it's a contributing factor in that case.
Thank you so much, Dr. Peterson. That was very informative. And I'll just ask Elizabeth now. So quite often in reporting those data, sometimes we've had to make some adjustments to those numbers based on feedback from KDHE. If you want to get into your interactions with Dr. Peterson's team, but also on how the data works, and in reality, it takes a while for death data for a year, not calendar year, but the reporting period to be finalized, if you want to get into some of those details. Yeah.
Absolutely. Thank you, Dr. Ariola. Let me first just say that we are exceptionally privileged to have Dr. Peterson and her team here in Johnson County. I think that if COVID-19 had broken out, even 2 or 3 years ago before we had our Office of the Medical Examiner, we would be in a very different situation. Her team has been invaluable from the very beginning. And in talking to counterparts throughout the state of Kansas, they have run into significant issues because they don't have that kind of working relationship with their coroner. We used to be in the same building, so we know Dr. Peterson, we know her investigators. And so as soon as this began, we developed a very close working relationship where we were providing tests. We were, having continual feedback about how to move forward and how this was going to look, because this was a new experience for all of us. And so when Dr. Peterson's team identifies a death that is likely due to COVID, they will send us an email. They send our team an email with the details of the death, the individual, whether or not there's a positive test already on record. And if they don't have one, but have been informed, for instance, from a family member that they tested, they will request that information from our team, since we have that. And so we'll communicate about any kind of test results. Additionally, they also include information about what the physician is going to sign the death certificate. As she said, the private physician, unless there's some extenuating circumstances, will sign that death certificate, and that is not part of the ME's role, the Office of the Medical Examiner's role. So they convey that information, pneumonia due to COVID-19. So what we do on our end as the epidemiology team is we go into our disease surveillance system and we mark that the individual died and the summary of death from Dr. Peterson's investigators. And we mark that, yes, the disease or the death was due to COVID, if that is what the physician is indicating. After that point, as Dr. Peterson said, the death certificate that the physician signs goes to KDHE. The Kansas Department of Health and Environment has an Office of Vital Statistics, and there they review that death certificate and note whether or not COVID-19 was either a contributing cause or a significant factor, as she described. Now, if the death certificate, the official record, does not include COVID-19, even if we had initial information from the physician that they were going to sign it as such, so it's marked in there that yes, the death was due to COVID-19, and then KDHE gets that death certificate and COVID-19 is not listed, then their responsibility at KDHE is to go back into that system, into that record, and say, nope, in fact, this was not due to COVID-19. And so when that happens, that's why you'll sometimes see our death count on our dashboard decrease. And honestly, usually KDHE does this in batches. So sometimes, we'll be adding deaths as we go along. We want the data to be as accurate and as timely as possible. So if we've gotten that initial information from Dr. Peterson's investigators or from Dr. Peterson that yes, it's due to COVID-19, we'll mark it. But then, maybe it's next month when that death certificate is finally registered with the state and they're doing their review. And so you might see, even 5 or 6 where the initial information said yes, and those final records said no. And so I think that even though it can cause some confusion as to why we are removing deaths from our death count, in my opinion, this is the system working, right? We do want to have as accurate of a count of the deaths associated with COVID as possible, deaths that are due to COVID. And so this relationship that we have enables that to be very timely. But sometimes, for some reason, we get the information from the physician that, yep, they're going to sign it as COVID-19, and then that final record does not have it. And we have to go with whatever that final record has because that is the official death certificate. So that's why you might see some fluctuations in the death counts, and sometimes we do remove a few. But again, I think that's the way infectious disease data works. As we get more information, as we get those final records, we update that to portray it as accurate of a picture as possible.
Has it ever happened the other way around, where a death was not contributed to COVID and then more research is done and then it turns out that actually that death was either a factor or the cause? Does it ever go the other way? Would you say?
Yes, it does. Dr. Peterson, if you want to.
Yes, it does. Absolutely. It can go the other way if we bring a person in and we do a test. It can go the other way if the death was not reported to us. And then we see it when we're doing cremation permit reviews. And now we're adding it days after the death because we're seeing it on that death certificate. And then there are some that make it all the way to the state before we find it out.
And do families play a role in this at all, as far as what they want the death certificate to say or not to say? And maybe not just in this situation, but in other situations. Is that a factor at all?
No. And that's the important factor of being in a medical examiner's office. We are independent, non-advocate, unbiased individuals who are filling out this death certificate. It is my job to say what I see and interpret what I see. So it is not up to the families of what gets put on the death certificate. Ultimately, it's up to that physician that's signing the death certificate. The way in which the death certificate is signed is also up to that physician.
And I will also say, because of the world we're living in, there are people who, have died due to COVID, and their family members maybe don't believe that it was due to COVID, whether it's because of some beliefs about COVID being not a thing or whatever that may be. And those death certificates do reflect that it was COVID-19, because again, that is independent of the family member's wishes and is based on the science and the information available at the time of death.
Okay, that was such great information. I think all of us got some good education there. I don't see any specific questions right now related to this topic. We do have some media with us, so feel free to put some questions if you have any in the Q&A. So we can move on to something else and then come back to this if there are questions. But both of you, thank you so much for sharing all of that. Dr. Ariola, Elizabeth, anything you would like to share about plans for this week with vaccinations, or anything else that's on your minds this morning?
Our clinics are running. Yesterday, we gave out over 2,000 vaccinations. Our target this week is about 10,000 shots, mostly second doses. There are quite a few first doses there. There are quite a few opportunities for walk-ins. And so those that are listening to us, go get vaccinated, take your family with you, go and get vaccinated. Tons of opportunities at our clinics. Doesn't have to be at our clinics. Pharmacists are giving shots. Hospitals are giving shots. So many opportunities to get vaccinated. While we have vaccinated quite a high percentage of our population, we're not quite where we need to be. We need to get more vaccines into the arms of more people so we can get to that population immunity where we all feel safer. So that's one thing to keep in mind. We are getting ready in case the emergency use authorization for 12 to 15-year-olds get approved in the next few days to vaccinate in that group. We are working on finalizing logistics about small clinics in the community. We are meeting with different groups, and we'll be making those information available very soon. Efforts continue. The goals have not changed. It is to vaccinate, to vaccinate, to vaccinate. And so we are going to continue to run our mass vaccination clinics while we are doing all of these community clinics. Again, trying to make it as easy as possible for people to get vaccinated. So we will be providing more information, if not today, definitely early next week.
And that has to do with that also people having a mechanism to request if they want you to come to them rather than them coming to you for groups. So.
Absolutely working on details of putting those information on our website where people can request. There are several meetings that are being passed, that are being planned. Elizabeth and our team are working on several of those. We have several teams that are working on things. Yes, those in the community, businesses, cities, there will be opportunity for you to make requests for us to bring vaccinations to you.
Great, thank you. We have a question from Kaylee McLaughlin with the Shawnee Mission Post. So if we can go ahead and open up her audio so she can ask her question.
Hi, last week there was a lot of talk about the variants of concern in Johnson County, and I was wondering where we are with like counting those variants and how sequencing them is going.
I will let Elizabeth jump in. We don't do the sequencing here. Those go to the state lab, but they do report those to us. And yes, there's been quite a few of the variants here, like we talked about. But Elizabeth, if you can put some numbers, approximate numbers there.
Absolutely. Unfortunately, the disease surveillance system is down this morning, and so I wasn't able to get accurate numbers before we came on the call. As of last night, we had 30 variants of concern. The majority of those being the B117 variant, which is so-called the UK variant. We've also detected the P1 variant or the Brazil variant in, I believe, approximately 5 patients here in Johnson County. And we have detected, I believe, 4 of one of the California variants. I believe it's B1429 in patients here in Johnson County. We have developed a mechanism for any individuals who have either a reinfection, so somebody who had COVID-19 and then within about 6 months developed COVID-19 again and had a second positive test. And so those are people, we believe that immunity lasts for about 6 months from natural infection. So when these people have another infection, we wonder if it could be due to one of these variants, and that's why they are having symptoms again. So for both those individuals and then also individuals who have had a vaccine and are considered fully immunized, so generally 2 weeks out from their second dose of Moderna or Pfizer, and 2 weeks to 4 weeks out from Johnson & Johnson, anybody who subsequently develops an infection and has a positive COVID-19 test after vaccination, we are working with all of those individuals to have them come through our health department to get tested, or we're working, say, with a hospital if they were tested through there to get those specimens up to the Kansas Health and Environmental Labs for whole genome sequencing. And so we're excited that we've gotten this process in place. With our capacity here, we're able to call and reach out to every individual who is positive. And so we are, I believe I heard that tomorrow we have already 7 individuals who are going to be coming in for testing for whole genome sequencing. And so those go to the state. Usually they test them, confirm that they're still positive because there's sometimes a lag between when they got that positive test and when they're coming into our office. And then they send them over for whole genome sequencing, and then we get that information back. So we are continuing to watch the situation. They are testing for a number of variants, both variants of interest, variants of concern. And then, at this point, there are no variants of high consequence that have been identified, but we're happy that this is in place because that way we have a better view of what's happening in our community.
And just to clarify those numbers you gave at the beginning, so you said there's about 30 cases of variant concern right now in Johnson County. The 5 that were the Brazilian variant and the 4 that were the California variant are included in that 30, and then the rest are the UK variant. Is that correct? That's
correct. There's 21 of the UK variant. I may have the 4 and 5 switched, but they're right there. So
okay. And then, did you say how many people you believe you're working with for follow-ups who have gotten COVID after being fully vaccinated? Did you give that number, or do you have a ballpark of how many people that is?
I don't have that number off the top of my head, but it is something that we have that's captured in that same system that, we talked about with the deaths and these variants. So we do know that there have been a few breakthrough cases, but so again, those are individuals who develop COVID after they're fully vaccinated. But if you look at the total number of individuals that we have vaccinated in Johnson County, hundreds, thousands of individuals, those are very, very rare cases. And most often they do not result in any kind of severe illness. Sometimes people will develop some cough or congestion and some COVID-19 symptoms, but are not usually having those really severe symptoms that are causing them to be hospitalized.
And those are the key things to keep in mind. Last time I checked, nationally, out of the hundreds of millions of vaccinations in the country, we've had not just about 6,000 breakthrough infections. So those are very, very small. And like she said, the key point is the symptoms are much more milder. And CDC really released a study recently where the odds of hospitalization in people that are vaccinated are 34% lower than the odds of vaccination hospitalization in unvaccinated people. So breakthrough infections do happen, will continue to happen. It's not new, but if you are vaccinated, the risk of getting infected is very, very low.
Thank you for that. It looks like we are caught up on questions both on Facebook and from our media that have joined us today. So I would leave it to the three of you to see if any of you would like to make any closing remarks before we wrap up for this morning.
Yeah, we've got Dr. Peterson here. I know she wants to talk about what she does. So maybe we'll have her speak to the public about the need to get vaccinated.
Yes, absolutely. Please continue to get vaccinated. It helps our caseload. We were quite busy during the December, January. I remember on Christmas Day, we had at least 10 to 12 deaths just in that one day. And since people have started getting vaccinated, the death rate has dramatically decreased. We appreciate that our workload has decreased. We don't like to see that high death rate. So definitely continue. One last thing, I guess, is the urban legend of if you're in a car accident and you have COVID, then COVID gets listed on the death certificate. It's just that. It's an urban legend. That is not true. As I said before, a medical examiner is required to complete all non-natural death certificates. A private physician is not legally allowed to sign that death certificate. And I can tell you that there have been no traffic accidents in Johnson County where I have listed COVID on the death certificate. So if you heard that from a friend of a friend, urban legend.
I'm glad we got that in. That's an important note for people to hear. So thank you so much. Dr. Ariola, Elizabeth, Dr. Peterson, thank you so much for sharing great information today. Jeffrey, thank you so much for being our ASL interpreter. We really appreciate that. Thanks to the media who joined us today and also those of you watching on Facebook. Thanks so much and have a great rest of your day.